Many individuals have the virus that causes shingles, and so it's very important that if you have potentially been exposed to chickenpox or had chickenpox, that you also know that you can get shingles. So as soon as you're eligible to get the shingles vaccine, you should get it. If you were born before the 1980s, you almost certainly got chickenpox. Many of us can remember getting chickenpox. And so the chickenpox virus, herpes zoster, actually then stays in your body for years, and pretty much for your whole life. And that's what can be reactivated as shingles. And a couple of things can cause it to reactivate, like stress, having a lowered immune response. Pregnancy sometimes can cause these things to reactivate. So most people are eligible for the shingles vaccine after the age of 50, and that's if you're a healthy adult and you don't have many medical problems. If you have any problems that affect your immune system, if you take medicines that affect your immune system, or if you have a condition like HIV, you should actually get the shingles vaccine if you're 19 and up. And that's because your chances of getting shingles are a little bit more increased in those situations. One of the reasons why we recommend the shingles vaccine, and one of the reasons why we want to avoid people getting shingles, is because of post-herpetic neuralgia. What some people get, even after the rash resolves, is they continue to get these sharp stabbing pain in that nerve area, and that can persist for months or years. It is incredibly, incredibly painful, that it can cause you to not be able to work. It can cause you to have trouble sleeping. It can cause you to have trouble doing your activities that you've enjoyed doing before. My dad got shingles, and he's this big old dude who's had many things happen in his life, and he said the shingles infection was one of the most painful things that he'd had. And it turned out that he actually had complications from shingles. He had post-herpetic neuralgia, because even after the rash resolved, he continued to have pain in the area where the rash was present for months. And we gave him medications. That's the good news, is you can take some medications to help, but it wasn't totally effective in suppressing the pain. And for these reasons, I would definitely recommend getting vaccinated, because it can reduce the chances of having some of these complications.